While COVID cases are still relatively low, something else is causing beds to fill up at children's hospitals all across the country. The U.S. Department of Health and Human Services says 3 out of 4 pediatric hospital beds are filled, even more than the average during the pandemic, and it's blaming a spike in RSV cases. Experts think that after masks, social distancing, and young children mostly staying home during COVID, some are now being exposed to other viruses for the first time in a long time.
What we're seeing is that some of the high risk patients, so babies that were born prematurely, very young babies, kiddos that have other respiratory issues like asthma, those are the patients that we're seeing coming in.
And we're seeing this locally too, which doctors say is unusual this early in the year. So we wanted to learn more about what you can do, or if you or your child get the flu, RSV, or any other respiratory virus. So we're joined now by family medicine Dr. Christine Alexander with MetroHealth Medical Center. Doctor, thank you so much for being with us this morning. We appreciate you.
So happy to be here with you.
I know as a parent, especially with kids under 5, this is what's on all our minds every time you go out, every time you put them in childcare. So what are you seeing at your hospital right now? Are you nearing capacity at all?
So, it certainly isn't as the capacity we had when we had the COVID surges. So I don't want to mislead the public and say, oh my gosh, this is, another pandemic, but we certainly are busy. And I think a good bit of what we're seeing is in fact RSV. And for the reasons that you had already said, we have children that don't have immunity. We have adults whose immunity has waned over time. And it's just, like the perfect storm to get these sorts of infections.
Sure. So a lot of these illnesses have very similar symptoms. What are the signs parents should really be looking out for with their kids?
So it's such a great question because there is so much crossover. There's RSV, but there are lots of other viruses around this time of year that can also cause symptoms. So with what we would ordinarily call a cold, which is an upper respiratory infection, it can be lots of nasal secretions, lots of kind of congestion that's not draining out. Once it starts to drain, it settles in the chest area, and they can have some achiness and a lot of coughing. The fever can be pretty low, but sometimes viruses will also give you a higher fever. So you have to be on the lookout for that fever. And that can also be the thing that helps you to determine, well, when do I really need to get a hold of my doctor's office? When the child has done well for a few days and then develops a fever, that might mean that we're turning into a bacterial infection, which would require an antibiotic. So the fever for me is kind of that clincher.
Okay.
Kids, when they get sick, and adults, when we get sick, we tend not to be so hungry. So, maybe the appetite should be something you keep your eye on. But when we get to the place where we really can't drink fluids, sometimes when kids are really congested and they have all of those secretions, they just can't drink. It's so irritating. So if your child or another family member aren't able to drink, aren't able to stay hydrated, that's another thing that should, set off the light bulb. I better call.
Okay, all good things to look out for. Now, in the event that hospitals do end up filling up, what should parents do? Are there other options? As a parent, you're just kind of looking to the medical professionals for next steps here.
Yeah. So I think